So the active surveillance is an active monitoring of the disease. Active surveillance has been introduced as a conservative management for the patients who are having a clinically localized prostate cancer. So it has been more popular nowadays that not all patients with the prostate cancer, they need a treatment. There are some patients that can be monitored for lifelong. So it has been introduced as a conservative management, and people with like slow growing malignancy, they can be spared with a radical treatments like radical surgery or radiation, and people with potentially aggressive disease, they can be cured at the right time. So this is the aim for active surveillance.
It's very unusual in the field of medicine to diagnose someone with cancer and then they say, we're just going to watch the cancer and see what happens. We're not going to treat it now. Because fundamentally, the belief is that if you treat cancer, the sooner you diagnose it and the earlier you treat it, the greater your chances of cure are. What we find, though, is that many men with prostate cancer will not die of prostate cancer, but will die of something else. A heart attack, a stroke, accident, or even another cancer. And this prostate cancer is not going to grow rapidly enough to kill them. And depending on the type of cancer they have, if it's a non-aggressive cancer, the chances that you can outlive your cancer over a 10 to 15 year period is around 95%.
I like to say active surveillance has to do with the patients being actively participating in how they can be healthier. And two things that are really important in our program is focusing on diet and nutrition and getting people to be more active. We think that it can reduce some inflammation. It can potentially help nothing to progress. And again, it's looking at the person as an overall person, not just looking specifically at the prostate cancer itself.
We are not looking at the cancer, we are monitoring them actively. So every 3 months we are going to check their PSA levels, their physical examination, we are going to check their progress, and we are going to make sure that they stay in active surveillance and their cancer doesn't come out of the prostate. So those are the things we look for here.
So urologists have tried to see if they can identify the cancers that are slow growing, that are not likely to kill you, and avoid treatment until it becomes absolutely necessary. And usually that is when the cancer changes and starts becoming more aggressive.